Come in.
Hi, my name's Chrissy. I'm going to be your nurse today. What's your name and birth date for me?
Megan Duckworth, 06/17/1992.
Alright, how are you feeling today?
Pretty good.
Good. So we're going to do a postpartum assessment on you, just see how you're doing. First thing I'm going to do is the breast exam. So that's the first letter in bubble sheet is B. And to this assessment, you're going to palpate and ask about milk production. How's your milk production been?
Good.
Good. If the mother is breastfeeding, you'll have to reveal the breast and check the breast for cracking, inverted nipples, or irritation. The U in bubble sheet stands for uterus. So to do this assessment, you're going to be measuring the fundus of the uterus. In order to do this, you can use your fingers and do, I'm going to reveal her stomach, and you can use your finger breaths. The uterus should decrease 1 finger breath a day and be unpalpable by 10 days. The next B in bubble sheet stands for bowel. And in order to do this assessment, you're going to ask about the last bowel movement. When was your last bowel movement?
This morning.
Good. It is not uncommon to have a bowel movement until 2 to 3 days after you have the baby. The next thing you're going to do is auscultate for bowel sounds. In order to do this, you'll put your stethoscope in, clean it off, and then starting in the right lower quadrant, you're going to be listening for a minute. And then once you hear bowel sounds, you go to the next. And the next. And then the next. The next B stands for bladder. You're going to palpate the bladder and check it for retention. You should also ask the patient if they have any pain or problems with urination.
I do not have any problems.
Good. And the patient should try to void every 2 to 3 hours.
Yeah.
Okay.
Okay, so for the second half of our postpartum assessment, we're going to look at lochia, which is the bleeding that she's having, or the discharge after the having the baby. So we're going to lift up her little her little panties and look at the pad to see how much bleeding she's actually having. A moderate amount of bleeding is normal. She could have up to about 2 weeks. And then we're going to turn you on your side and look at your episiotomy. We're also looking for bleeding under here to make sure she isn't having an excessive amount of bleeding. When you look at the episiotomy, you're looking for redness, ecchymosis, edema, discharge, and approximation. Hasn't had an episiotomy, then you're looking for swelling and other signs of infection and abnormal things. Go ahead. So that was the E of bubble sheet. S of bubble sheet is her support system. So who do you have at home to help you care for the child?
My husband.
Okay. Is he good?
Yes, he's very good with children.
And then the H of bubble sheet is the Homan sign, which we would not do. We would first look to see if she's having swelling or bruising or anything that might indicate that she already has a deep vein thrombosis. If that's not, then you can check the Homan sign, which is you're going to pull your toes up towards you, and we're looking at her legs for venous distension. Relax. The last part of bubble sheet is E for emotional state, and we're looking for the mother's reaction with the child. So we have her infant here, and you're watching that mom makes eye contact.
Hello.
And
Yeah.
she cares for the baby, and that there isn't disassociation or lack of emotion between the mother and the child.
It was laughing. It doesn't love me. It's broken.
Mine's never bring my child.